Welcome to part one of our three-part series for nutrition counseling for the AG Network. Today, we will discuss the purpose of nutrition counseling and the role of the registered dietitian. On behalf of the National Resource Center for Nutrition and Aging, we thank you for being here today. So who am I? My name is Jocelyn Evans, and I'm a registered and licensed dietitian. I'm also certified in gerontological nutrition. I'm currently a consultant dietitian with the National Resource Center for Nutrition and Aging, and I have 5+ years of experience working with the older adult population, both in long-term care and the community settings. First, let's discuss the background and purpose of nutrition counseling within the AG network. According to the Older Americans Act, the Assistant Secretary shall carry out a program to making grants to states under state plans approved under Section 307 for the establishment and operation of nutrition projects that provide nutrition education, nutrition counseling, and other nutrition services as appropriate based on the needs of meal participants. So now that we know that nutrition counseling is a required service according to the Older Americans Act, let's define what nutrition counseling is based on the State Performance Report. Nutrition counseling is defined as a standardized service by the Academy of Nutrition and Dietetics that provides individualized guidance to individuals who are at nutritional risk because of their health or nutrition history, dietary intake, chronic illness, or medication use, or to caregivers. Counseling is provided one-on-one by a registered dietitian and addresses the options and measures for improving nutritional status with a measurable goal. Nutrition counseling should be measured in hours, and also partial hours may be used. Outside of nutrition counseling being a required service by the Older Americans Act, how else does it fit within the goals of the Aging Network? As specified in the Older Americans Act, congregate and home-delivered meals are required to provide at least 1/3 of the dietary reference intakes and dietary guidelines for Americans for an older adult. But what about the other 67% for the day? That is where nutrition counseling comes in. As a dietitian, it provides the opportunity for us to educate older adults to reach 100% of their nutrition requirements for the day. We know that optimal nutrition reduces the risk of chronic disease, reduces falls, and helps your body to feel its best. Also, on a financial standpoint, in regards to the importance of nutrition counseling, we know that Medicare provides reimbursement for nutrition counseling for certain diagnostic codes. These benefits are often underutilized and could represent an area of revenue for your organization. So how prevalent is chronic disease in older adults? It is estimated that almost 80% of older adults have one chronic health condition, while half of all older adults have 2 or more. In 2015, it is estimated that about 25% or 12 million seniors had a diagnosis of diabetes. In addition to this, 1.5 million Americans are diagnosed with diabetes every year. We know that nutrition counseling is an essential component not only for diabetes management, but also for other chronic diseases. Due to the increased risk for chronic disease in older adults, there is also an increased risk for falls. According to the National Council on Aging, over 67% of the Falls Prevention Program participants indicated that they have multiple chronic conditions. Falls are among the leading causes of injury and death among adults aged 65 or older, according to the CDC. So how efficient is nutrition counseling? According to a study done by the Academy of Nutrition and Dietetics, a majority of participants, 62%, made dietary changes as a result of nutrition counseling with a registered dietitian. In addition, 43% noticed improved health outcomes. So now let's discuss the differences between nutrition counseling and nutrition education. According to the Academy of Nutrition and Dietetics, nutrition counseling is a supportive process to set priorities, establish goals, and create individualized action plans which acknowledge and foster responsibility for self-care. Medical nutrition therapy, or nutrition counseling, involves in-depth individualized nutrition assessment and a duration of frequency of care using the nutrition care process to manage disease. In contrast, nutrition education is defined as the reinforcement of basic or essential nutrition-related knowledge. Next, here are some examples to further distinguish nutrition education from nutrition counseling. An example of nutrition education would be a nutrition educator asking a class of participants to take a brief questionnaire about cholesterol, fat, and sugar intakes. Nutrition counseling would be the registered dietitian performing a nutritional assessment with an individual. Another option of nutrition education is a nutrition educator teaching a heart-healthy class to a group of older adults. Nutrition counseling would be the registered dietitian and individual meeting to determine goals, care plan, and interventions, and a plan for follow-up visits. Now let's discuss some best practices for the Aging Network regarding nutrition counseling. First, offering multiple options for consultation, including the Area Agency on Aging office, a congregate meal site, the participant's home, and also telehealth. Ensure there is privacy for the participant. Next would be setting up a referral process to obtaining participants. Exploring reimbursement avenues such as Medicare or private insurance. Providing your consultant dietitian or staff dietitian with a platform for documentation. Creating a program to market nutrition counseling services, and also encouraging follow-up consultations. So what role does the registered dietitian play? The role of the dietitian varies at every agency and organization. The dietitian may support many purposes within the RD's scope of practice at each organization. Many area agencies on aging throughout the nation have had great success by staffing a licensed and registered dietitian. In fact, some states require each of its AAAs to have a licensed and registered dietitian on staff for a minimum number of hours per week. So here are some sample job duties of a registered dietitian. Developing nutrition education handouts and also providing the nutrition education. Conducting nutrition counseling as needed, including but not limited to conducting nutrition assessments, screenings, medical nutrition therapy, and follow-up care. Assisting in planning and approving menus to meet nutritional requirements. Supervising meal sites. Creating nutrition newsletter content. And conducting health promotion classes. Some additional examples include assisting with grant applications, participating in the promotion of nutrition services, maintaining and updating professional knowledge by participating in educational opportunities, reading professional publications, maintaining personal networks, and participating in professional organizations. When looking to hire for a dietitian as a consultant or on staff, here are some attributes to look for. Self-promotion, self-confidence, comfortability with technology, organized, understanding, realistic, friendly, kind, self-motivated, trustworthy, empathetic, and approachable. So where to find dietitians to contract with? One option would be local hospitals and clinics. When making contact, request the dietitian or dietary department. They may be inpatient or outpatient staff. Some dietitians will work both, but you would prefer an outpatient dietitian. Another option is the Academy of Nutrition and Dietetics. They have a resource on their website called Find a Nutrition Expert that locates dietitians in your area. You may also check local and state chapters. Another option is called the Dietitians in Healthcare Communities. This is a subgroup of the Academy of Nutrition and Dietetics that specializes in consultant dietitians. Lastly, local grocery stores may also employ dietitians. Additional materials. The PDF version of the nutrition counseling guides for the Aging Network and the registered dietitian are available on the website www.acl.gov/seniornutrition. Also included in that PDF version of the nutrition counseling guide for the Aging Network is a sample contract for a consultant dietitian. One disclaimer, this is a sample contract and is recommended that you use your own counsel to adjust as you see fit. This concludes part 1 of our 3-part series of Quickeners of nutrition counseling for the Aging Network. Part 2, we will discuss referral methods, telehealth, and billing. See you then.